Hello and welcome. Today's webinar is a commemoration of the 50th anniversary of the Elliot Lake miners' strike. It's our first webinar that we've done in Teams. They were always done in Zoom in the past, so we are having a few of our people coming in. Hopefully all our presenters will make it in on time, but we apologize if there's a little bit of a disruption there, making sure everybody's in. We ask that during the presentation portion that the audio and video be from the presenter only. To turn on closed captions, go to More, Language and Speech, turn on live captions. Please use the chat feature for any discussions and post questions arriving from the content in the Q&A. This will help us to find your questions for the allotted Q&A portion while allowing people to have a conversation in the chat. As the webinar is only 40 minutes in length and is immediately followed by our wellness session, time may not permit for us to answer all of them during the webinar. The answers will be posted on our website, along with a link to the video recording and a copy of the slides. This can be found under Education Webinars. I'll be sending a communication of attendance email after the webinar, and will include a link to that page with the communication. Confirmation of attendance. I will also include the topics covered and the length of time spent in the webinar, as some people have requested this to send to the professional association. I just received a call from John Perquin, who's trying to get into the meeting. Just let me check and see. I need to change my slides. Oh, he's here. Okay, thank you. I want to make sure he was able to get in. So today's webinar will begin with a statement of commemoration from our President and CEO, Natalia Moziani. It will be followed by a brief geographical and historical context of Elliot Lake. We will reserve the bulk of our time today to converse with our guest, John Perquin, retired assistant to the International Secretary-Treasurer, United Steelworkers, and one of the members of the board of the Institute about the strike. This interview will be followed by a guest presentation from Take Action on Radon, represented by Pam Warkentin, Executive Director of the Canadian National Radon Proficiency Program, C-NRPP, and the Canadian Association of Radon Scientists and Technologists, CARST. Dr. Anne-Marie Nicol, PhD of Simon Fraser University, BC Long, and Take Action on Radon will hopefully be able to join us if able. As time permits, we will have a Q&A session with our guests. The final 20 minutes of our hour will be a wellness break with Anastasia Juroska, founder and director of Salem Dance Company in Toronto. Today's webinar will begin with a statement of commemoration from our President and CEO, Natalia Moziani. It will be followed by a brief geographical and historical context. Sorry, my slide did not advance. This Elliot Lake miners' strike changed health and safety in Canada and led to the foundation of the Radiation Safety Institute of Canada. Today, we have with us representatives from our board and advisory committee, as well as present and former staff, including John Perquin, Dr. John Barrett, Maureen Shaw, Ken Newman, Brian Bjordahl, and Tina DeGoss. Natalia, President and CEO, will now read a statement of commemoration on behalf of the Institute.
Lynn, thank you very much. And I wanted to say welcome to everybody on this Zoom call. We are honored that you are joining us. And as Lynn pointed out, we're commemorating a historic event that is so much more than a point in history. It is the event that has changed health and safety for Canadians, not only for miners, not only for Ontarians, but across the whole nation. And we're very proud to be able to be a part of that history. And I also promised Lynn and John that I will stick to the statements and not freestyle, to give the opportunity for our presenters to share their experience that is so unique in this topic. And thank you, Lynn, for giving me the opportunity to read the statement. 50 years ago, the uranium miners of Elliot Lake, led by the United Steelworkers Union, took a courageous stand for their health and safety. In an unprecedented wildcat strike, these brave men and women walked off the job in protest of unacceptable working conditions in the mines. On the 50th anniversary of the strike, which is today, the Radiation Safety Institute of Canada stands with unions, workers, their families, and all Canadians, honoring the legacy of the strike and commemorating the pivotal moments in the Canadian labor history that catalyzed transformative changes in the national health and safety landscape. This historic event sparked a seismic shift in Ontario's approach to occupational health and safety. The subsequent inquiry, led by Dr. James Ham, commonly known as the Ham Commission, shed light on the dire need for regulatory reform to safeguard workers' well-being. In response, in 1979, the Ontario government enacted the groundbreaking Occupational Health and Safety Act, a legislative landmark aimed at preventing workplace injuries and illnesses. Decades of toiling in hazardous underground conditions and excessive exposure to radiation left miners with severe lung diseases. In the aftermath, hundreds of miners lost their lives battling occupational lung cancers and silicosis. The United Steelworkers 1974 Wildcat Strike was a watershed moment in occupational health and safety in Canada. And for the Institute, the milestone was more than a breakthrough in the labor movement's stride for worker safety. It also marked the origin of the Institute itself. Born out of the Elliot Lake tragedy, the Institute was formed as an independent organization with the mission of protecting workers from excessive radiation exposure and ensuring that such disaster never happens again. From its earliest days, the Institute embarked on a mission of safeguarding the health and well-being of those working in hazardous environments. Recognizing the urgent need for proactive measures, it pioneered the groundbreaking early cancer detection program known as sputum cytology. This innovative initiative proved instrumental in saving lives, offering minors at early diagnosis and intervention. While the Institute's mandate has expanded to encompass a broad spectrum of radiation safety issues, its origins remain etched in its DNA. Today, as we commemorate the 50th anniversary of the Elliot Lake Wildcat Strike, we reaffirm our commitment to honoring those who perished and those who fought for the change. The Institute continues to stand as a guardian, monitoring underground uranium miners for exposure to radiation and ensuring that the hard-fought lessons of the past are not forgotten. As we look to the future, the Institute remains steadfast in its mission to uphold its beginning's proud legacy, save lives, and ensure that no worker is ever overexposed to radiation. Through our ongoing efforts, we honor the resilience and sacrifice of the Elliot Lake miners, and we pledge to carry their legacy forward, forging a path to safer, healthier workplaces for generations to come. And this statement is brought to you by the Institute Board of Directors, its staff, and advisory council members. Thank you for the opportunity to share it with you.
Thank you, Natalia. As a background to the interview today, let's consider the context of the mines of Elliot Lake in 1974. There had been mining of uranium in Canada since the 1930s, with Canadian uranium being used to support the Manhattan Project. For more on this, see our webinar on the National Day of Mourning, April 28, 2022. Uranium deposits in the area of what would become Elliot Lake were first staked in 1952, with the mines and a town being rapidly developed just north of Lake Huron before the end of the 1950s. From the Ham Commission report, between 1954 and 1958, 12 mines came into regular operation in the Elliot Lake region. Total employment at Elliot Lake rose from about 500 at the end of 1954 to 10,000 at the end of 1958, end quote. The strike occurred approximately 20 years after the mines first opened. Employment numbers fluctuated with market conditions during those years and in the years that followed. With this information in mind, we will now move to our guest interview to learn more. I wish to thank John Perquin for providing images from the United Steelworkers Union from the time of the strike, which will be used as a backdrop to the conversation. Welcome, John. Thank you so much for being here today and with us to help us better understand the importance of this historical event. Before we go into more detail about the miners' strike, can you let us know a bit about the United Steelworkers Union and your role within the organization? Hopefully we can hear John. John, I think you're muted. I think if you push the space bar, it should unmute. There you
How's
go.
that? Any better?
That's perfect. That's perfect.
Okay, sorry about that, folks. Let me start by saying thank you very much for the opportunity to participate in this event. I think it's wonderful that the Institute has taken some time to commemorate the 50th anniversary of the Wildcat Strike. It was an important event, and it's important that people today understand it, and hopefully they'll come out of this event with a better awareness. So the Steelworkers itself is an international union consisting of approximately 850,000 members. It's across the United States and Canada, Puerto Rico, and the Virgin Islands. Represents people who work in many different sectors: mining, metals, manufacturing, rubber, plastics, healthcare, education, and so on. You think of a sector, and we probably represent somebody in that sector. In Canada itself, the Steelworkers have about 225,000 members. So we're a large union in the private sectors. We're not public sector, although we do have a few members in public sectors that work for some little towns and communities and what have you. Myself, I started with the Steelworkers in 1981 when I went to Elliot Lake. I'm an electrician by trade, and I was working in that field underground, first at the Quirk 2 mine, and then I got transferred after a year or two over to the Panel mine, which were a couple of the mines that Rio Algum operated in the area. Not long after I finished my probation, I got into the health and safety field. I had always been interested in that. And from health and safety, I morphed into becoming a workers' compensation representative for the local union. Eventually got elected as the financial secretary for the local. And in 1987, I was asked to come on the staff for the International Union. And so I left Elliot Lake and went to work for the union itself in Toronto, and worked there for a number of years. I became the health and safety coordinator for all of District 6. And then eventually in 1996, I was asked to go to Pittsburgh, assume the responsibilities of the assistant to the health and safety department head in our international headquarters. So I began overseeing health and safety all across North America. And then in 2001, I became the assistant to the International Secretary Treasurer and remained in that position until I retired in 2019. And today I'm a member of SOAR, which is the Steelworkers Organization of Active Retirees. And we're very active on the lobbying front, political issues, healthcare issues, and what have you. So that's my background briefly.
Thanks, John. That's quite a career and ongoing. So the strike started 50 years ago today, April 18th, 1974. Oh, sorry, this keeps doing this to me. Okay, I know from speaking with you that even though you started working in Elliot Lake after the strike had concluded, many of the people who were involved that day were still working there. Based on conversations you had with them, and what you had learned over the years of involvement with the United Steelworkers, can you describe the working conditions for underground uranium miners before the strike occurred?
It was terrible. Very briefly, quickly. The conditions in an underground mine, if you've never been to in an underground mine, nothing is flat, nothing is smooth. Everything is dependent on artificial light. You see a picture there on the screen that shows what's called a scoop tram. hauling away some of the blasted ore and rock and waste and what have you. You see the miner there. I'm looking, but there was in earlier years, there was a different kind of mining. This is called mobile mining. And in the earlier years, in a lot of the mines in Elliot Lake, they had conventional mining, which used what we call jackleg drills and stopers. The jackleg drills were used to drill into the face of the ore, and then they'd blast it. And the stopers were used for what we called ground control. You would drill up into the roof to stabilize it so that it wouldn't collapse on you and that sort of thing. It was very rough. Everything is very jagged. You're always worried about slipping and falling and hurting yourself in that regard. But the dust was even worse than that. In the early days of the mines, they had readings of dust that was over 17 times the allowed standard. And this was causing huge problems for folks, especially when you put it into context that this is a uranium mine we're talking about, and radon daughters are present and they easily attach themselves to dust. So it became a huge problem for them. And things didn't change for a number of years. They were like that.
So compared to other workplaces in the years leading up to the strike, how did the health and safety in mining compare? And how did health and safety in uranium mines compared to other mines? Like, was it worse than other mines, or was it, the whole mining industry an issue?
So health and safety in underground mines was never great in the early years. The uranium mines were worse than others, and hard rock mines were worse than soft rock mines. In Elliot Lake, we're dealing with hard rock mines, and because you're drilling into the rock, there's a lot of dust that comes out of that, and that dust contains silica. So the hard rock miners were particularly exposed to silica, and a lot of them contracted silicosis, which in years can become evolve into lung cancer. Compared to other workplaces, as I said earlier, underground mining was a rough, dark place. It's black. It's pitch black. You can't see the front of your nose. You have to have a cap lamp or other artificial lighting in the travelways and whatever. There weren't any real health and safety laws in place. There was a mining act, but it dealt more with how to develop mines, how to explore for mines, and how to set up mines and that sort of thing. Very little involved with worker health and safety protection and that sort of thing. So these are the early rudimentary days that we're talking about. So
it's funny to think that early rudimentary was the 1950s, right? Like we were, a lot of us, that's not so long ago.
In the field of health and safety, that's still early.
Yeah. So there was a special committee on mining practices at Elliot Lake report published by the Ontario Department of Mines in 1959. What prompted that report, and did anything change as a result? Because that was before this strike that we're talking about today.
Right. That commission was struck because of the number of fatalities that were occurring, and particularly in 57 and 58. There was a huge spike over the 2 years. There were over, I think, around 25 deaths that occurred due to traumatic incidents, whether it was rock falls, being hit by equipment, or what have you. So there was a call to strike a commission, if you will, and do a study to find out what was causing it, and to make recommendations around how to improve that and eliminate the number of fatalities that were occurring. I don't think personally that a whole lot came out of that from terms of improving health and safety in the workplace. It largely made recommendations around transportation, how to improve it underground, how to maybe improve ground conditions, ground control to prevent some of the rock falls and whatever that was occurring. But the report wasn't really put into effect in any single way in terms of legislation. But it did make one interesting point in the report, and it noted that, as we've said all along, companies put costs ahead of their employees' well-being, and that's a quote from the report. And I thought that was a significant quote, because we've been saying that forever.
Right. So April 18th, 1974, it was a Thursday. What caused everyone to walk off the job just before the weekend when they've been tolerating these working conditions for years?
Because that was the day there was a membership meeting. But in particular, at that membership meeting, the men heard a report. They had concerns over the years about the number of, as I said, cases of silicosis and lung cancer. And they were sure that there was some linkage between their work and what they were experiencing. But the companies said, no problems, just keep working, that there's no high dust, this is normal. And the governments basically told them to keep working. They had asked the Workers' Compensation Board if there was any direct link, had any studies ever been done, and were basically told no and not to worry, just keep working. They kept complaining, and the mining company said, look, if you don't like it, there's the highway, take it. Somebody else is just waiting at the door to take your job, kind of thing. So they were doing their own work to try and strengthen their arguments to convince the governments and the employers about the horrendous problems they were experiencing. And they found out about a conference that was being held in France, and they sent a couple delegates. That conference was talking about the link between uranium mining, radon exposure, and lung cancers. And so they felt that this would be an excellent opportunity to learn more about the issue. And lo and behold, while they were there, the Ministry of Health for Ontario released a report about a study done on the miners in Elliot Lake. And it showed that they were working in excessive radon exposures and were dying of lung cancer at 3 times the expected rate in the normal population. Now you have to understand, they had asked were any studies being done, and had any been done that they could refer to, and were constantly being told no, only to find out that they themselves were the subject of a study and had never been told and never had agreed to being part of the study. At any rate, those delegates came back to Elliot Lake, and they made the report at the membership meeting on April 18th, and the men said, we've had enough of being lied to. And they took immediate action. They said, it's time, we're going to take the matters into our own hands. And they went to the mine site and put up a picket line. And that was the Wildcats, the beginning of the Wildcat strike.
So for those not familiar, what's a Wildcat strike as compared to a regular strike?
The Wildcat strike is an illegal strike. It's not sanctioned by the union. It's spontaneous, usually. You could lose your job. You could be held financially liable, if push comes to shove and the employer sues. So it's a very extreme action, and the men felt that it was important enough that their health and their safety required that they take this extreme action to get people's attention.
How long did the strike last, and why did the workers decide to go back to work?
So the strike lasted 14 days, I believe it was 14 or 15 days. And the only reason they went back to work was because they had applied a public pressure campaign and a relentless pressure on the government of the day, the provincial government of the day, which was the Bill Davis government. And eventually the government and the employer came to understand that the only way that this Wildcat strike was going to end was if they would agree to strike a royal commission to do a study of the conditions in the mines. And when they finally got that agreement, the men said, okay, we'll go back to work.
So James Ham was chosen to chair that royal commission that was agreed to on the health and safety of workers in mines. He published his final report in June of 1976, and in it there were 117 recommendations. How involved were the workers and the unions in the development of his final report?
The unions were very, very involved. We, the steelworkers, had a representative on the panel. We had the international appointed two of its staff to help coordinate the local union's efforts to make presentations orally and to make submitted written briefs into the panel. And as it turns out, Dr. James Ham took the recommendations made by the steelworkers and others, not just the steelworkers, but many unions were also involved. Took those recommendations to heart and took them very seriously, and many of them found their way into his report. There was a recommendation to set up what's known as the internal responsibility system. That's where the employer has responsibilities to provide a safe workplace, safe equipment, and make sure that the employees are well trained in the hazards of their workplace and are aware of ways to avoid those hazards and mitigate them. Supervisors have responsibilities to make sure that the people under their control work in a safe manner and work with the appropriate protective equipment. And they work on safe equipment. And the employees themselves have a responsibility to make sure that they're working in a safe manner and that the equipment is safe and that others around them are also working in a safe manner. So they have a responsibility to report anything that's unsafe. So that was the internal responsibility system. A major recommendation and major outcome of that. The three rights, as people often know them, which is the right to participate, the right to know, and the right to refuse. So you have employees have a right to know what they're working with and the hazards. They have a right to participate in health and safety decision making in the workplace, and that's done through joint health and safety committees in larger workplaces, or it's done through health and safety representatives in smaller workplaces. And those members of the joint health and safety committees are union appointed. In the old days, the company used to get to appoint who was going to represent the workers. So now it's the union or the workers themselves, if it's a non-union workplace. And then the right to refuse. If there's unsafe work, if you're assigned to an unsafe job or in unsafe conditions, you have a right to refuse. And then the Ministry of Labor will come in and do an investigation. And those rights were, in many of the recommendations, and James Ham recommended that they become part of the Occupational Health and Safety Act, which eventually they did. And then beyond Ontario, other jurisdictions in the country adopted very similar rights and protections. So now that it's all across the country.
Yeah, and I think that, myself and talking to other people about this event that happened, I think that's the major thing that a lot of us don't recognize, is that internal responsibility system and those basic rights that when you are an employee that you learn about, that we don't necessarily recognize that came out of this Elliot Lake miners' strike. So it was a huge change to occupational health and safety.
A lot of men lost their lives. A
Yeah.
lot of men lost their lives over that. None of it was given to us because the companies wanted to or because the governments wanted to. We fought for every bit of it.
Yeah. And did things immediately change for the underground uranium miners?
No, they didn't, unfortunately. Almost immediately after the Occupational Health and Safety Act was enacted in 1979, the Atomic Energy Control Board stepped in and said, wait a minute, guys. Elliot Lake, the mines are uranium mines and they're under federal jurisdiction. So you don't have the protections of the Ontario Occupational Health and Safety Act. And unfortunately, the Atomic Energy Control Act at the time had far inferior protections for health and safety. So despite everything that other workplaces got, the miners in Elliot Lake were were subjected to a much lower standard of health and safety. So again, they took matters into their own hands in a sense, and they set about to bargain collectively in all their collective agreements, all the protections that were in the Occupational Health and Safety Act. And then what they did was they lobbied the governments, and they lobbied the employers to come to an agreement to afford the same protections that were in the Ontario Occupational Health and Safety Act, and legislate them for the mines in Elliot Lake, for the uranium mines. And an agreement was struck and signed June 18th, 1984. So a little over 10 years after the Wildcat strike, the miners in Elliot Lake finally got the protections that they were fighting for.
Well, thank you, John. I'm just looking at the time, so I think, this is something that, it's near and dear to the Institute, and also I know that it's a big topic. If people do want more information about the strike, you can always send questions to info@radiationsafety.ca, and I don't mind writing John and getting some answers back from there. So with that, I'm going to hop over to talking to Pam Warkentin, and she is the executive director of CARST and the C-NRPP. I don't know, Dr. Nicol had another appointment. She may be able to hop in at some point, but we're not sure. And Pam is going to speak about what's going on modern day in Elliot Lake with the Take Action on Radon project and upcoming plans for measurement in Elliot Lake. So I'm going to move the spotlight over to Pam and let her speak. So thank you, Pam. There we go. There we go. All right. Hi, Pam.
Great. Yeah, thanks. And I will just quickly go through a review of why we're focused on this project or launching this project, other than the fact that it's to celebrate the 50 years and we wanted to work with Radiation Safety Institute on a special project. But we are focused on radon exposure in homes. Much of the work that was done in the mines did help us lead to the knowledge of the exposure link of radon to lung cancer. And so now we are raising awareness across the country, helping people understand that they also need to be paying attention to their radon levels in their home. And in Canada and in many other countries as well, radon exposure is the leading cause of lung cancer for non-smokers, and then also is a significant contributing factor to people who smoke. And I'll get you to jump into the next slide. Anne-Marie, do you want to carry on, and then I'll jump back in to talk about the project?
Sure. Thanks, Pam. And thank you, everyone, for inviting us to come today and talk about our project. Well, radon really was initiated in this country as an occupational exposure. The majority of Canadians are exposed to radon primarily from indoor air in their homes. So inside homes or even other buildings like workplaces where people spend more time. And it enters through homes through cracks in floors or walls, spaces between drains and sumps. So from the ground floor into the home, and that's because radon is part of the natural decay of uranium, which is present in all soils across Canada. And that's an important part of this project, is that we've been testing homes for quite a while across the country, helping people to better understand their exposure to radon. And we know that levels tend to be higher in lower spaces, so places with ground contact and indoors in basements. Next slide, please. So some radon surveys have been conducted residentially in Ontario through our project. So we wanted to flag that. Actually, on the left are slides that represent Health Canada's percentage of homes that have tested above the radon guideline in Ontario. And this project that we've been running for now the last 7 years, we're actually finding some differences between what the original Cross Canada Radon Survey found and some of our own more targeted testing of places in Ontario. So you may be familiar with many of these communities, and on the left, on the axes, it shows the percentages of homes above the 200 becquerel guideline, which is the residential exposure guidance. And you can see it does vary in Ontario with Thunder Bay and Marathon, which I believe are fairly close communities, at least to Elliot Lake. We're looking at about 15% of homes, but it can vary. And we are seeing communities again with higher and higher proportions and above 200, which has to do with a lot of different factors, which we might not have time to discuss at the moment. Next, please. I'll hand it back to you, Pam.
Yeah, sounds good. And so testing for radon in a home is relatively easy. However, it does take a long time. So 3 months is the recommended duration to test for homes. And it includes placing a detector in the living space of the home. So as Anne-Marie talked about, we often think about basements being the highest level. So we'll talk about testing there, but really it can be in all areas of the home. And so we want people to test where they're occupying the space. So testing is easy. And then also, not only is that easy, but we also have concrete methods for reducing. And so on the next slide, there's some pictures of a little simplified version of what radon mitigation looks like, and then a couple photos of what it looks like in person. And so radon can be reduced in homes, and really a lot of the early research did come out of community projects like Elliot Lake, and there was other projects in Canada, and so we're thankful for that. We've taken a lot of that early research. We've been working on it and developing standards and making improvements to it. And so there may be homes in the Elliot Lake area that have something similar to this. Maybe the fan has been unplugged, or maybe it no longer works as appliances do. And so you can certainly look at participating in our project because maybe you just need to replace the fan, and we need to tweak it to make it more effective as well. Or maybe you've got a successful system that has been helping keep your levels low in your home already that we can point attention to. So the good news is the system is easy to install. It does need to be installed properly, and we do want it to be installed in a way that is really energy efficient. So that we do have a national certification program, which I think I talk about in the next slide, of trained professionals across the country. And so we certainly have some locally, and then to help as well. But we do have standards to make sure that the systems are installed properly as well. So that's a little bit of background. And oh yeah, one more thing, there is also radon has been included in the building code. So in Ontario, currently it requires the municipality. So Elliot Lake is a municipality that includes it in the building code. There are other municipalities across the province where they have this 3-option system. It looks a little bit different, but it is part of the building code. And now we anticipate this changing. Ontario is going to be harmonizing with the National Building Code, so it's going to be across the entire province in the next year or two. So radon measures are included in the National Building Code and in some areas of the province. Okay, and so then that's a little bit about the background. I mentioned that radon testing is easy, and this is a little picture of what a radon test looks like. We call it a puck, or I mean, it's about the size of my palm. It comes in a sealed package. You open it up, leave it in place for 3 months, and then you need to ship it back to the lab. So as part of the 100 Test Kit Challenge, we're working with Radiation Safety Institute to make this easy for people in Elliot Lake to sign up. We do have a limited number of kits available, so once we launch in the fall, there will be a pre-registration, so you can register for your free kit. And then we do this as a community because we want to do it together. So you'll be able to test for, pick up your test over a 1-week period, and then leave it in place. And then we'll have a 1-week collection where everybody can drop their tests off. You'll get your individual report, which will be maintained private between you and the lab. But we will also create a summary report with the data after that. And so that's the project that we're excited to launch coming in fall of 2024.
Thank you, Pam and Anne-Marie, for letting us know some modern day things happening in Elliot Lake. When you think about it, John, that, it's because of the actions that were taken and what the miners in Elliot Lake that went through that brought about the Institute. And now the Institute is able to work with Take Action on Radon to help support Elliot Lake. So that's why we had all of this included in today's webinar. But that one day, it was very, very important. The people that worked in the mines, they took a risk of, being fired, losing their money for the week. Like I know at different points in my career, I've been part of unions and been parts of strikes, legal strikes and such. And that can be a financial hardship, but I know with a wildcat strike even more so. So we appreciate you coming today. We don't really have time at the moment to get into a Q&A. If people do have questions for Dr. Nicol, Pam, John, if you can put them in the Q&A, or you can always email info@radiationsafety.ca. Here's the contact information here, that we can give you more information about the project upcoming in Elliot Lake, or the Take Action Radon project just across the country, because they look for different communities to sign up, and they do 100 test kit challenges and things like that. So if you want more information about that, or information about the from John about the actions of the United Steelworkers on that day, there's more pictures that the USW has from the strike. I wasn't able to include them all, but John is a great resource about the history, because I do think that a lot of people are not aware about this major action and then the Ham Commission and what came of that. So with that, are there any parting words from John or Pam or Anne-Marie? John, is there anything you want people to take away from this day and remember?
I think that hopefully people have become a bit more aware that again, as I said earlier, the protections that we work with today in our workplaces didn't come because they were given to us. They came because of solidarity, because of action, because people felt that their lives and their health were important enough that they took risks, including up to losing their jobs, their livelihoods, and being fined and what have you. Never in their wildest dreams, did the guys who took action that day ever believe that it would come to what it's come to today, and that their actions have created safer workplaces all across the country. And there's still a few of them, a handful of them that are alive, that I talk to on a regular basis, and they're actually very proud of what they did.
Yes, and again, we first talked about this on the National Day of Mourning, which is coming up at the end of the month, and we must remember that it's ongoing, that there still are people that lose their lives at work, despite all the changes that have been made. So we must put continuous effort into keeping workplaces safe and low risk. In terms of Pam and Anne-Marie, any last words in terms of the challenge and getting people aware of radon?
I'll just add that it is personal stories that really motivates us, and that prevention is possible. So just like the stories of the miners, lessons learned there are many stories of people with lung cancer that we've been learning from, and really trying to get the word out for prevention. So we encourage everybody to test their home for radon and prevent their future lung cancer risks.
Thank you. Anne-Marie?
And I'd like to extend my thanks to those workers 40 years ago for having the courage to stand up, because it really has galvanized the work that we're doing here in Canada. And we wouldn't be here today if their efforts hadn't gone forward. So we really appreciate it. And the health of Canadians is going to benefit from the work that was done. So yes, you should feel, I think, really proud of the big steps that you took to get this industry, the radon reduction industry, off the ground. So thank you.
And Natalia, since you're here, and I'm so glad to have you here, Natalia, last words on behalf of the Institute before we move to dance.
Thank you very much. Each time I hear John talk about Elliot Lake, it reminds me of how personal and human the stories are. Pam and Anne-Marie, to your point as well, it is a big watershed moment, but it is also a moment that is so filled with pain and suffering and families who had to deal with this in the aftermath of exposure. So, John, thank you so much. It is important for us to remember where the Institute, where the origins are, and why it is important today, everything that we do based on where we've started. So thank you. It's inspirational every time hear you talk. Thank you so much.
Yes, thank you. And thank you to everyone who came. I will, once we're going to move to dance, I will send out an email next week that'll give links to information about Radon, links to resources, including papers and newspaper articles and clippings about the strike itself as well. And now what we're going to do is we have Anastasia is here because we're all about wellness, right? We're about lowering risks in workplaces to radon exposure. But again, with the webinars, we have to consider also our body, right? And how well we are. So we have Anastasia back. She was with us about 3 years ago for about 5 webinars, and she's going to be back and get us moving and stretching. I know some people will have to get back to work at some point because this is over their lunch hour, but if you can get up and move a little bit, that, you know, we have to take care of our immediate physical needs as well, not just the long term.